Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Wassalatu wassalamu ala asyrafil anbiya'i wal mursalin Sayyidina Muhammad wa ala alihi wa sahbihi ajmain. Assalamualaikum warahmatullahi wabarakatuh to everyone joining us from around the world. It's a pleasure to have you with us today. Dear brothers and sisters, on behalf of ISIP, the International Students of Islamic Psychology, I would like to warmly welcome you to today's webinar. My name is Nur Azima from Brunei Darussalam, and I will be your moderator for this enlightening session, inshallah. Today's lecture will be presented by Brother Yaqeen. We are honored that he is dedicating his precious time to share his expertise and experience with us. The theme of today's lecture is how to cope with depression using Islamic psychology intervention. To begin, let us start with the recitation of Surah Al-Fatiha to seek blessings and barakah from Allah Subhanahu wa Ta'ala.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين.
Amin, amin, ya Rabbal Alameen. Thank you for joining us again. Now, let me briefly outline our agenda for today. We will begin with the recitation of Surah Al-Fatiha, which we have just completed. I will provide some guidelines and information to ensure a smooth session. Feel free to send your questions in the chat throughout the presentation. We will listen to a lecture by our esteemed speaker, Brother Yaqeen, followed by a question and answer session. Lastly, we will close the session with feedback forms and a closing dua. To ensure a smooth and productive session, please follow these guidelines. If possible, please keep your cameras on to create an engaging and interactive environment. All right, sorry. Let us continue. Okay. We also recommend switching to gallery view to see all participants and feel more connected. Please refrain from recording the session or taking screenshots to keep our content secure and private. Inshallah, the recording will be uploaded and shared on the ISIP YouTube channel. To minimize background noise, kindly keep your microphone on mute when not speaking. For clarity, please rename yourself in Zoom to include your name and also your country. This helps us address you appropriately and understand the diverse backgrounds of our attendees. If you have any questions, please use the chat option to submit them. We will address these questions during the designated question and answer session. If you need live transcription, click on the More option and select Request Live Transcription to enable subtitles for the session. Okay, a little bit about ISIP, the International Students of Islamic Psychology. ISIP is an inclusive space designed to connect people with diverse backgrounds interested in Islamic psychology. Our goal is to disseminate knowledge, share resources, and discuss best practices in a free and accessible manner. We support the personal and professional development of those passionate about Islamic psychology. Whether you are pursuing studies, advancing your career, or deepening your understanding within your community or country, we provide the resources and opportunities you need. Here are some ways to stay connected and engage with our community. Join our WhatsApp group for ongoing discussions and quick updates. Visit our website at www.isip.foundation to become a member and access our extensive digital library with valuable resources on Islamic psychology. Subscribe to our YouTube channel for the latest content, including lectures and also workshops. Follow us on Instagram at ISIP_global for updates and highlights. You can also scan the QR code for our Islamic psychology group, which you can find here. Feel free to use it if you find it beneficial. Now, it is my pleasure to introduce our distinguished speaker for today's session, Brother Yaqeen. Brother Yaqeen is a renowned expert in integrating psychology, spirituality, and research to boost performance and empowerment. He specializes in training leaders and teams across diverse organizations, emphasizing transformational leadership and mental well-being. Trained in multiple countries, Brother Yaqeen is a psychotherapist and research scholar committed to enhancing workplace mental health and resilience. As an international speaker, he has presented in over 35 countries and is fluent in several languages. Brother Yaqeen is also a published author and actively participates in non-profit and peace-building initiatives, currently based in Istanbul, Turkey. Today, Brother Yaqeen will share his insights on how Islamic psychology can be used to cope with depression. Please join me in giving a warm welcome to Brother Yaqeen. Without further ado, Brother Yaqeen, the floor is yours. It is an honor to have you with us.
Assalamu alaikum. I hope everybody's doing good. Thank you so much for the warm welcome as well as the introduction. I have a presentation that I would like to share using my screen because that would make it easier for all of us to, follow through today's topic. I hope the screen is up and you're able to see it, which is great. So I would like to thank the organizers, the international students of Islamic psychology. I mean, I've been following your work for a while, and alhamdulillah, it's been a great honor and pleasure to see all the efforts that are being put in learning more about Islamic psychology. And here we are talking about this topic of family and community trauma and how do we cope up with the depression that can come out of it using our own worldview and faith and Islamic psychological intervention. So I think it's a really important and profound topic to talk about if we start with that. So to start with, as the sister has already introduced me, I'm a practicing psychotherapist. I'm based in Istanbul, Turkey. I'm also writing my PhD thesis currently in clinical psychology, and it is also about interventions using traditional Islamically integrated psychotherapy or TIP. And I am from Kashmir, from India. And because I am from there, so the topic of community and family trauma in the Eastern world, it actually makes more sense. And I'll try to explain that in the ongoing lecture. So I think the reminders have already been given. And what we are going to discuss is I'll be taking you through this journey in which we'll talk about an introduction and why it's important to discuss about family and community trauma. And then we'll talk about what does it exactly mean when we talk about family and community trauma and what is the effect of it? Because before we go to the intervention part, it's extremely important to know that what effect can family and community trauma have on individuals. And then the most important part, how do we heal from the trauma, from the depression, from an Islamic perspective, if we have undergone it because of our family or the community we live in? And then the way forward and conclusion, and we'll end up, inshallah, with some of the questions and answers from you, for some of the questions from you all. Now, to introduce the topic and to start with, it's important to note that what we are going to discuss about family and about community, it's a really profound issue. It is profound because how we relate with family and community has a deep impact on who we are and what we become. But at the same time, I also find it that it's often overlooked, right? It's somehow brushed under the carpet that sometimes protective factors, which are like the family and community, huge protective factors, they can also sometimes become maladaptive and can start working against us and be counterproductive, so to say. So it's important to address that it's a two-way street, that family and community that's supposed to protect us, enhance us, be there for us. But if it doesn't go that way, as Allah has prescribed us, it goes in a different direction, it's important to address it. And I think addressing the issue is the first part of creating awareness about anything, including trauma. So where does it start? It starts acknowledging that the issue is profound and our community, our ummah, our family might be going through this, or we might be the victims of it. And to start with that acknowledgement, and then we can go ahead with what can we do about it, right? And it's important to discuss the why of any topic, that when we talk about family and community trauma, why is it important to be discussed and what is the significance of it? So if we talk a little bit about that, I think it's very important to address it. I think family is the cornerstone if we talk about our Islam and if we talk about our worldview, because family is the start point of guidance, and family is a unit which provides us that sense of belongingness, that initial focal point. And when we are growing up, when we are children, before knowing who Allah is, we know who our family is. And the way we relate to the family, the kind of communication, the talks, the image of God or Allah subhanahu wa ta'ala, it starts developing right through our family. We start seeing it through that lens, which is why the family unit is so important in the Islamic worldview, that 1/3 of the laws that we actually have, Islamic laws, they're actually pertaining to family. And sociologically, we look at family as a social construct. But when we look at it from the Islamic perspective, it's more than that. It's a sacred institution, and it's sacred, and it's ordained by Allah subhanahu wa ta'ala. As he mentions in the Quran, that and fear Allah, through whom you ask one another, and the wombs, meaning to say that the kinship, and indeed Allah is ever over you, an observer. So the initial role model that we have, that how we look at us, how we look at others, and how we look at the world at large, it all starts from the family, shaping of our behaviors, of our personality. It starts there. And then from the family, when we go outwards, all the families together, it forms the community, which we also call as ummah. And Allah says that you're the best of the ummah that is created, like the best of the communities. So we have a relationship, a core relationship with the family, and ultimately family has a relationship with ummah. And this relationship is a dual relationship or a symbiotic relationship, which means these are systems. An individual is a system, family is a system, community is a system, and these systems do interact with one another. They have an effect on one another. We as individuals affect our family, affect the ummah, and the ummah also affects our family, and the family affects who we are. So that is, and there is an existent reciprocal relationship between these systems, and it's important to mention this when we are talking about the significance of it. Now, when we come to the significance, especially from the perspective of trauma, from the family and community, it's important to talk about where does it all start, to get an important background and context of the whole topic that we are talking about, right? Interestingly, when we talk about like the father of sociology, we're talking about Auguste Comte, we're talking about people like Durkheim. They discussed an important aspect of social norms, what is known as deviance. So deviance is, there is an established social norm, and when we move away from that norm, that is known as deviance. In other words, we have references to it in our faith as well. So for example, we talk about in the Islamic perspective, Amr bil Maruf and Nahi anil Munkar, that you enjoin to people what is good and you forbid what is evil. But good, which is translated from the word maruf, is not an exact, accurate translation. Maruf actually comes from the word urf, and urf is used in fiqh as culture. So Allah is saying you enjoin what is known good in the community, what is established as a norm. We all know lying is bad, murdering somebody is bad, taking away property of someone is bad. So those norms are established, and that's very important. Now, when we talk about deviance from the norms from a sociological perspective, we talk about Durkheim, for example. The idea of people who are criminals or who do a crime. Crime is considered a deviance from the norm. It's not a norm to be a criminal. But where does the deviance come from? That's an important question to be asked. The deviance or the deviant behavior, it has a lot to do with family structure. So when we see somebody doing a crime out there, it is actually a reflection of what the society is doing behind their doors, what the families and how they are traumatizing children behind the doors. And then when these children grow up, that's just a reflection of the society, of the traumas that have been perpetrated. Interestingly, if you do a study of serial killers, and there is a book, it's called Serial Murder by Sage Publications. They have published case studies of different serial killers in just one book. And when you study it, every person who was a killer who is mentioned in this book, you start reading it and you realize there was not something right within the family structure. All of them were traumatized when they were growing up. There was always that abuse which was there. Meaning to say that we are always bound by our experiences. So when we talk about reality in that experiential sense, it's not something separate from us. We cannot separate our experiences from our reality. So, for example, referring to Heidegger, who talked about the world is not something separate from us. Rather, we are always already in the world, and our experiences shape our understanding of reality. So, the family that you live in, the community that you live in, apple doesn't fall far from the tree. That does shape our understanding of reality. And that's where it becomes more subjective, which is why Allah subhanahu wa ta'ala, when Quran talks about reality and understanding of it. In Surah Fussilat, for example, we will show them our signs in the horizons and within themselves until it becomes clear to them that what is the haqq, that it is the truth, right? So the reality from an Islamic perspective as well, there is the internal experience of it, and then there is the external observation of it. Meaning to say that the realities of the families or the community, it will be reflected in the individuals. We cannot escape that. And it's important to have this background, to have this context. Now, where do I come into this? Because I've been doing what I do as a practicing therapist from last 5 years. And because I'm from Kashmir, and a lot of the cases that I actually deal with are trauma. And initially, when I became an independent therapist after my master's, I was thinking that people who undergo trauma, especially in my hometown, Kashmir, it will be because of the conflict, because Kashmir is a conflict zone. And what I realized from my therapy practice was that most of the cases of trauma that I actually saw in my practice was actually family trauma. And in the eastern part of the world, it's very different than the Western world. In what sense? You go to a Western therapist, they're going to tell you, your family has become toxic. Just break off. You don't need them anymore. You can live as an individual. You're very autonomous and all those things. But in our part of the world, it's not that easy. You can't just walk away and you'll be like, you know what, I'm breaking all the ties with my family. That's not an easy thing in our community to do, which is why Western therapy is not helpful. It will always fail the individuals who are Eastern or who are Muslims, for example, because we believe in the community. We are not that individualistic that you can just walk away from people. So it's important to understand that family is an integral part of us because they are so close, because we are close to community as well. That means there is more power in these units or institutions to also hurt us and to go the other way around. So that was some background and context I wanted to provide for today's talk. And then when we come up to recognizing what family trauma and community trauma is, I'll also be talking about some of the examples or some of the ways in which this trauma from the family and community is actually manifested in our society or in the families for that sake. So when we are talking about trauma, we are talking about a psychological response here to an event that has happened that was very distressing. And that, as a result of that, we might feel it's difficult to cope or it's overwhelming. And the sense of self, of who we are and our identity, it is greatly shifted when we are talking about trauma. In the same way, when we talk about trauma from a more Islamic perspective, we are talking about a tribulation. We are talking about a test of Allah, which is there to test our faith and how patient we are in these difficult times. And it's also seen trauma, when we reframe it from an Islamic perspective, it's also a challenge for us towards our spiritual growth and to be close to Allah if we have that mindset. So, in other words, trauma is anything which overwhelms us psychologically, that we have coping mechanisms, right? But what if what we are dealing with is way bigger than our coping mechanisms? And that is the state of what we call as psychological trauma. And Allah says in the Quran, just to contextualize it, and we will surely test you with something of fear and hunger and a loss of wealth and lives and fruits, but give you good, glad tidings to those who are patient. And Allah also mentions in Surah Ankabut that do the people think that they will be left to say that just we believe and that would be enough, and they will not be tried, and Allah will not test our patience with different tribulations. But the good part of it is that Prophet ﷺ said that no fatigue or disease or sorrow or sadness or hurt or distress befalls a Muslim, even if it were the prick of a thorn. He receives and Allah expiates some of the sins for that. And that's the good part or the silver lining of trauma when we talk about. And the other part, which is important to characterize, is about the depression, right? And depression is more about feelings of low mood, which actually affect how we think and how we feel and how we act. And the things that we are generally interested in, that significantly diminishes. And most of the time, a person feels low or person feels sad. And this is a state what in the Islamic terminology can be huzn or gham, which is more like distress. But the idea of depression from an Islamic perspective is that it's not something that Muslims are immune to. You know, we often hear this, that mental health problems or conditions are immediately in the Islamic world characterized as the lack of faith. But that's not actually true. I mean, nothing can be far from the truth. Muslims are not immune to mental health conditions, including prophets who are the most revered, most knowledgeable, most people with the most taqwa. They also had these challenges and tribulations. An example of that, Yaqub alayhi salam had profound grief over the loss of his son, Yusuf alayhi salam. And what does Quran mention about it in Surah Al-Yusuf? That I only complain of my suffering and my grief to Allah. And I know from Allah that which you do not know. And that's how Prophet ﷺ, he went through the whole year, what is known as Am al-Huzn, or the year of the sorrow, when in the same year he lost his beloved wife Khadija and also his protector and uncle Abu Talib. So these are examples from our faith and our worldview and our religion, that it is okay as a Muslim to undergo trauma. It is okay as a Muslim to feel depressed. There is nothing wrong inherently with your faith if you are depressed or if you're undergoing trauma. So you don't have to question it, that is it lack of faith? No, even people who had the highest amount of faith went through these trials and tribulations. It's important to remember that and to reflect upon that. Now, when we talk about family and community traumas and thereof depression or sadness which can come out of it, a good question to ask would be, how does it manifest, or how do we feel this trauma and what effect it has on us? Effect we'll discuss, but just for some contextualization and background, and those of you who can relate to it, and those of you who are already practicing therapists, you might have seen this if you work with Muslim populations in your practice. So one of the things is, I'll give an example of this. You know, there are these trees, you know, which grow on the roadsides, and then once a year or when the seasons change, there are these people from the municipality, and they will come and they will just trim the trees in the parks and all these hedges, and they are just made straight to look like a single line, like there is this symmetry. This is called as hedging. And we love it because we love the symmetry. We see that all the trees are cut properly, all the bushes, they're just done in the right manner. But what if one of them is not done correct? It bothers us, right? It's an eyesore. It's not good to look at. So, so the hedging here in this context, I'm talking about conformity, right? It's interesting that our communities sometimes and our families, they want us to be conformists, that whatever is happening in the community, in a specific culture, how we marry, how we do our rituals when somebody dies, how things are done, and everybody has to follow that in order to be a good person, right? We're talking about conformity. And I think one of the things that our ummah has come to is this fact that we think unity is conformity. It's not. You can very well be a dissident. You can very well voice out your opinion while being united. Unity is not conformity. We have misunderstood this concept that everybody has to be the same, and that's the idea of unity. And if we look at the Quranic perspective, which is very beautiful, and it says, if you obey most of those upon the earth, they will mislead you from the way of Allah. They follow nothing but conjecture, assumption, and they do nothing but lie. Meaning to say that even if majority of the people are doing something, that's not necessarily correct. And if we feel like, within families, how we are told always, right, that we have to be a certain way in order to qualify as the good son or the good daughter, or if we don't do it like that, it will not bring us honor and respect. And this is just about the family, nothing to do with the religion. So one of the ways that the trauma within the families manifests is that individuals in the family or in the community are made to conform with things that they are also not comfortable with. That is one of the ways that everybody has to be this way. Oh, you have to look up to your brothers or your family. All of them are successful doctors. And what are you studying? Like, finance or, arts? Like, who does that? You have to do something else about it. And then this idea goes further when it takes the form of guilt tripping, right? When individuals within the family are made feel guilty for the things that they shouldn't be feeling guilty about, right? Like children having the responsibility which actually parents should be doing, right? So for example, if there is a conflict between parents, so the children somehow act as the mediators. Or if there is a marital discord between the parents, the eldest son or daughter has to take the role of the parent to take care of the others. And if they don't do that, they are made feel guilty of how could you do this. And then it takes another form, which is even the more dangerous form of it. It is when the parents or the community forces an individual to do something by using religion and weaponizing religion. If you don't do this, you'll be disobeying your parents and you will end up in hellfire. But that could be something like a career choice, which Allah and Islam has given enough leeway for us to decide what we want to study, to decide what job we want to do, the person that we want to marry, so far as it's within the framework of the religion. But what if it is weaponized against you? And that very well leads to trauma. And it also is based on this idea that if Muslims are in different parts of the world, and I'm definitely sure that we are connected from many different countries, and it was also asked, like, you can add your country to your name. And Islam is not like there is not this stereotype that a Muslim looks like this, or a Muslim is like, there is a stereotype and a person has to fit in, because Islam is not a monolith. The Islam that is followed in Indonesia is different than the Islam which is followed in Kashmir. Like, our fundamentals are the same, but what I mean is the cultural adaptations, they're just different. So this idea of all of us have to be the same, or we are pressurized to do things that we are not comfortable with in the name of religion, can actually traumatize people and in reality put them far from religion that we will be talking about. Now, interestingly, based on my practice and based on studies of research, what is the effect of family and community trauma? Because it's important once we characterize a problem, before we move to the intervention part, how do we heal from this trauma? We have to first talk about what it has done to us, what it has done to an individual, or what it has, or the profound impact it have had on this person because they were undergoing this trauma from the family or community over an extended period of time. So, to start with, personality changes is the first effect and impact of family and community trauma. So, especially when we are talking about specifically childhood trauma, because children don't have all the mechanisms of coping and resilience developed. So, in the formative years, huge changes of personality can happen because of family trauma. Because family is the closest people that we have, and they are a part of the community. And research shows us that mental health conditions have or personality disorders have something or a lot to do with what happened during the childhood. So for example, we have conditions like dissociative identity disorder or DID. It's clearly based on how the childhood of that particular individual was, and it's based on childhood trauma. And we have BPD or antisocial personality disorder. So research does show correlation with mental health conditions and personality changes because of family trauma. So trauma can disrupt our personal development. It can make us more vulnerable, and later on this can translate into difficulties in building interpersonal relationships, and it could be withdrawal, aggression, maladaptive behaviors, or problems in the workplace. So one of the core things that is affected by the trauma is actually personality change. And then we have this mistrust or the breach of trust or trust deficit, which is also a result of traumatic experience in which a person feels that they were betrayed or they have been harmed by the people that they trusted, community leaders, imams, family, right? The abuse coming from them. And that's why there is this idea by Freud, which is the betrayal trauma, where the victims of abuse feel that they have been violated by the people that they trusted. So they develop this mistrust and they find it hard to trust other people again, right? So this distrust in adulthood has something to do with childhood as well, because this mistrust develops over the time in the child when you grow up in a family like that or in the community, is because it's a protective mechanism. Because if you don't trust someone, you wouldn't end up feeling hurt. So the idea is don't trust anyone, which later on becomes maladaptive because it can lead to isolation or difficulty in making relationships in both professional as well as personal settings. Another effect which can be there is this lack of agency and autonomy because of the manipulations and of the trauma. And one of the things that the perpetrators can do within the community and family is to make you dependent on them, that you cannot exist and you have no independent existence, even though when Allah subhanahu wa ta'ala calls us for account, we would be called to account as individuals, right? Not as families, which means that we do have the sense of agency and autonomy. And this is compromised, this self-determination of a human being, if we undergo trauma. So this loss of agency where we feel disconnected, humans feeling disconnected from who they are or from their emotions, which can be difficult later on in traumatized individuals to develop self-efficacy, or there will be this dependency, because one of the other manifestations of childhood trauma is actually dependent personality disorder. And that's where the people have difficulties in making decisions for themselves, and they would want other people to make decisions for them. So this over dependence of others can also be a result of the trauma. And the most important one to me, which I have also seen in my therapy practice, is we see individuals with resentment against religion, right? This hatred towards religion. And they would be like, oh, we are ex-Muslims now. I'm not a Muslim because look at the texts of Islam and it doesn't make sense to me. But that's just the surface of it. Because I have talked and I have done therapy with individuals with such beliefs. But in therapy, when we talk at an emotional level after we go through that intellectual kind of a talk, and you look deep down, and I have always found, at least in my limited experience, that it's always rooted in feeling wronged, and feeling wronged by religion because they were not expecting it. And these are good, decent, honorable people who just were not expecting that. um, they held religion at a very high standard, but being abused by leaders in the community or their family who supposedly are Islamic and they practice religion, that was not the expectation. And when there was this mismatch between what they expected out of religious people and what they saw, they ended up with this resentment against religion. And these spiritual struggles have very well been researched, that how negative experiences with religious communities can actually lead to this resentment and anger towards God and disaffiliation. Like, I don't want to have to do anything with the religion, right? So, this abuse from community leaders or within the family, which is religious, can be extremely traumatic. And this can lead individuals, when they see these people who are supposed to be role models and they see them acting in a manner which is not very religious, so to say, they end up rejecting their doctrines of faith. And that's where the spiritual distress and those identity conflicts start coming in. So, this is an important part that we can reflect within our community. Those of you who have experienced it themselves, or those of you who are practicing as therapists, or who are on the path of becoming therapists. And if you work with Muslim populations or religious populations, you will certainly meet people who have been wronged in this manner, and then they have developed a resentment against the religion. And a lot of the times we question ourselves that there are these alternate lifestyles, like LGBTQ and others. They are on the rise, and what is happening suddenly, right? And the reason for that, again, is that children or young people or young adults who are marginalized, they also want to develop resilience. But how do they develop resilience? They cannot go back to the mechanism which actually hurt them. In this case, it could be religion, for instance. So they want to try something out of that box. They want to try something very different from that league in order to feel the sense of belonging and identity. So that's how trauma leads individuals seeking out groups or lifestyles that offer them acceptance, that offer them validation. So that's where such people feel that they can express themselves, feel empowered, and they are countering or standing up against the oppression. So sometimes this can also be a manifestation of the trauma from the community when the community doesn't stand by you, right? Like I talked about the stereotype, like, if you fall into this group, then you have our support, which is very conditional in that sense. But if you don't act according to how we want you to act, then you are someone who is not a part of us. And that's people start losing the support of the community, of the family, which is extremely unfortunate. And I've just wanted to emphasize this because it's important, and you will see people and groups and your clients and patients who have undergone this, and you might have seen some of these manifestations as well. And because we are talking about this trauma, and we are talking about people who might go against the religion and who might have all these different ideas, there is an important reminder and an important note to myself, and which I would like to share with you as well, which is this: that I have seen a lot of people struggling when I do therapy with them, right? And sometimes when we see people apparently and their views about religion, and it just puts us off, like, how can somebody do that? But when we know them deeply, and then we realize that something inside of them was hurt many of the times. So rather than judging people, it's it's important that to realize the fact that we don't know the journey of others. So if we haven't walked their path, we have no right to judge their destination. Maybe they will repent to Tawbah and become way better Muslims than us. And before we judge other people and think that we know them, reality is we hardly know ourselves. And Imam Ghazali, the Mujaddid and the genius that he was, he has this treatise, and this is important. He has this treatise, about the criterion of distinguishing Islam from, Zandaka or the masked infidelity. So he talks about in this book, he talks about what will be the fate of those people who have not been properly exposed to Islam or who have been presented with a distorted view of it. And Al-Ghazali says this, and I'm quoting the text, which is in the italics. Indeed, I would say that the mercy of God encompasses most of the Christians of the Byzantine lands and the Turks of this age, meaning those among whom the message has not reached. They fall into three categories. So, what are the three categories to which the message of Islam has not reached or has not reached properly? First, those who have never heard the name of Muhammad Sallallahu Alaihi Wasallam at all. Second, those who have heard his name but have received distorted information about him, such as being told that he was a liar and he just claimed prophethood. So these people are in the same position as those who have not heard of him. And then the third and the last category, those who have heard accurate information about him or about Islam, but have not given it proper consideration due to various distractions or negative influences in their environment. All these individuals are excused and their fate is left to the mercy and justice of Allah subhanahu wa ta'ala. And this is profound. This is profound because sometimes we are quick to judge. It's important to realize the fact that what Al-Ghazali is saying, especially the last third point, it's about people who do know about Islam, but they have been raised with a distorted view of Islam or the Islam that they saw in the community, or they saw the actions of the Muslims when non-Muslims look at Islam about what Muslims are doing. And if it was distorted because of what the media is saying or because of what they saw is happening within the family or the community and they got away from it, Al-Ghazali says that their fate is to the mercy and the justice of Allah, that such people will not be held accountable in the way those who knowingly rejected the faith. So the Allah's mercy extends to those people as well who had this resentment of religion that I talked about as an effect of trauma. So there is an excuse, and that is from our text. So it's important that we are not judgmental and that we are kind and that we believe in a religion which has very broad fundamentals and basis. So we don't reduce it just to judge and shun and shut off other people. It's also about mercy. It's also about acceptance of others. And that is what leads to change in therapy and in the hearts of the people, ultimately. And then the most important perspective about healing from trauma and healing from this depression, and what does Islam, our faith, say about that? I think, first of all, when we talk about healing, we have to acknowledge, especially in terms of trauma, that we have to establish safety by creating safe spaces, right? It's important to ask ourselves as individuals first, to ask ourselves this question that, am I a safe space for others? You see, when Prophet Sallallahu Alaihi Wasallam, he got the wahi and he goes to his wife and talks about his experience, and then he goes to his best friend Abu Bakr, and they're like, we trust you, it's okay, we believe in you, that Allah has spoken to you, right? Now imagine the magnitude of this, that there is this claim that Allah talks to me through angel Jibreel, and this is not an easy claim to make. But the people closest to our Prophet ﷺ, they were like, yes, we believe you. Why? because all his life, for all the 40 years, he had never lied to them. He had never manipulated them. They knew that he is Sadiq, the one who speaks the truth. He's Amin, one who can keep the amana, that he is a safe space, that even if he makes such a claim, which is as big as Allah talks to me, we believe him. So the question to ask ourselves is, do we have such a character that reflects the truth, that other people come to you and they are safe? They know that words are an amana, as Prophet ﷺ said, that whatever is said in private is amana, like talking about therapy or even outside of the therapy. So do people feel that when they're around you? I mean, you don't have to be a therapist for this. You just have to be a Muslim. But if the person, your friend, your family, or anybody else is afraid that if I tell this deep thing which has hurt me to this person, what if he tells it to others? So are we safe spaces for others? Are we trustworthy? Are we the people, like they say in Arabic, that the hearts or the chests of successful men or successful people are the graveyards of so many secrets, which means that these people know so much, but they have just never talked about it, the confidentiality part. So asking yourself, do people feel comfortable around you? Because we are here talking about healing the trauma, and it starts from us, from who are working in the community. So do people feel that comfort? Do people feel that they can talk to you? It's comfortable, it's a safe space. And not only as individuals, we also have to talk about community centers and masajid. So the role of masjid in Islam is not only a space where you pray 5 times a day. No, it has way more functionality and sustainability. And the community centers that we have, are they safe spaces, or are they places which judge others and bring down others? And then we question that, why are our young people not getting closer to faith, and why are they getting away? The question would come back to this creation of safe spaces, that how do young people feel around when they're in the mosque? Are they criticized? Right? In our part of the world, you're not having a cap on your head, somebody will come and force you on top of your head, right? Uh, I mean, many other things as such, like who are leading these masajid we are talking about, who are leading these community centers, and are they safe spaces? So if we talk about healing, it always has to start with creation of safe spaces as individuals and as a community in our community centers as well as in our masajid. After that, it's very important to understand and contextualize trauma, that how it is a test from Allah subhanahu wa ta'ala, and not everybody gets the same test. So it can also be an opportunity to show resilience and spiritual development. Yeah. And like I said before as well, and we'll surely test you, as Allah says in Surah Baqarah, with something of fear and hunger and loss of wealth and lives and fruits, but give glad tidings to the patient. So I think understanding that trauma is a part of our spiritual journey, it's important to contextualize it like this, because it helps in reframing this experience from the context of faith and hope. Because it's important to contextualize and acknowledge trauma. So the understanding part is not only about the knowledge, it's also the acceptance that it happened. And even though there is suffering in life, it can be, and it is a test from Allah subhanahu wa ta'ala. And now is the time to show patience so that Allah may purify us. And it is a time to acknowledge what happened, to understand what happened, to say that yes, it happened, because that is the way forward. Because once you're in the safe space, it's important to acknowledge what had happened. And the role of the therapist or anybody else here is to validate that emotion. Yes, it happened. It's not to gaslight, right? One of the manifestations was gaslight. No, nothing like that has happened. No, it cannot happen. It's not like that. You haven't understood it. So many times in therapy, I see young people, especially females, and who have undergone sexual abuse through the family. And what would we expect? Talk to someone about it, right? And they did talk to their families about their experience. And the family was like, nothing like that has happened. It's just in your mind. How can this happen? He's your cousin, that's your brother. You think, or this is your uncle. How can he do that? So you see this thing like nothing like this has happened. like making you question your own sanity. So imagine a person who's traumatized because of sexual abuse, and they are made to question their own selves and their own sanity if something like this happened or not. So that is a compounded trauma. And we need to talk about that. We need to understand and acknowledge that, no, it happened. Now let's see what happened. One of the things that re-traumatizes and compounds the trauma, makes it into complex trauma, is when the person opens up. It's not easy to open up about trauma. And they open up about their trauma. They tell it to the person that they trust the most. And they just said nothing like that happened. Imagine how that would feel, like you're opening this wound, you're opening it up, showing it to someone, and they're like, it's fine, it's not even a wound. How's that going to feel? Invalidating someone's experience like that. And how these people are going to have that faith again in these people who invalidated their trauma. So it's important to acknowledge what happened, and then we talk about what will be healing, because safe spaces are important, because when stories are told in safe spaces, that's what leads ultimately to healing of trauma. And that's where the guilt and the shame disappears, when people feel safe and that they feel acknowledged. And then turning to Allah, be it through our daily prayers, and be through tahajjud or the night prayers, right? And Allah is ultimately with those who seek help through prayer and through patience, right? In Allah sabirin. And sabr is very important, like the patience to go through it while you're dealing with it, because it's not easy to overcome trauma. It's a process, and that does need patience. I think one of the important aspects of heartbreak is when, I think this is how it is, that every heartbreak is a redirection in the direction of Allah subhanahu wa ta'ala. Like, because the world is not perfect. So whenever the heart breaks, these cracks are the way through which the light of Allah subhanahu wa ta'ala can enter again in the heart and connect us with Him, because the world keeps disappointing us, because that's its reality. And there is this beautiful, beautiful prayer of Prophet Sallallahu Alaihi Wasallam in Musnad Ahmad, which is mentioned, that we tell our distress to Allah subhanahu wa ta'ala by saying that no person suffers anxiety or grief and says, "Oh Allah, I am your servant, son of your male servant, son of your female servant. Your forelock is in your hand. Your command over me is forever executed, and your decree over me is just. I ask you by every name belonging to you, which you have named yourself with, or revealed in your book, or taught to any of your creation, or preserved in the knowledge of the unseen with you, that you make the Quran the spring of my heart, and the light of my chest, the burden, the trauma, the banisher of my grief, and the reliever of my distresses. And Allah will take away his sorrow and grief and replace it with joy." So this is a very important dua that Rasulullah taught us, that when we are going through grief, through sadness, through trials, through tribulation, through traumas that we have, after we acknowledge them, we pray and we make dua to Allah that this has happened to us and you are the deliverer of goodness. So deliver us to that goodness. It's important to do that. And then remembrance of Allah, right? So it's ala bi zikrillahi litatma'innul qulub, like it's important that hearts find rest in the name of Allah and in the zikr, in the remembrance of Allah, right? So those whose hearts are reassured by the remembrance of Allah. So it's important that this is something that brings peace to our heart, because we do acknowledge that qalb or heart has a huge part when it comes to healing from trauma. And patience, we talked about how important it is, but it's also important to have faith in Allah, that this was a part of Allah's plan. And what is also known in Tasawwuf, you have this concept called taslim, like acceptance of the reality. Do not resist it, right? Accept it, acknowledge it, because whoever relies upon Allah, sufficient would be Allah for him or her. So believing that Allah's wisdom and plan, that you had to go through that pain and suffering and sorrow and sadness and grief and heartbreak. But then there is Allah who loves you, who put you through that. So there must be some wisdom in that, because in suffering there is also blessing. So recognizing that healing is a process, that I will be patient, and Allah does not burden a soul that more than it can bear. So it's important as a part of that feeling to have that sabr and tawakkul. And ultimately, this might sound a bit counterproductive, like we are talking about hurt from family and community, and we're talking about support from them as well. Because not everybody in the family or in the community is bad or evil. And even though they might be the people who hurt us or who broke us, it's still important to have people who are safe spaces, like we talked about, to those who you can talk to connect with those people you find compassionate and talk to those people, right? And one of the things that can really help is volunteering for a cause, right? Like, spending your time and efforts. It could be volunteering in the mosque or a community center nearby. That's also because when we are in the service of others and we help others, we also start healing. You see, from the Western CBT perspective, if we talk about, thoughts lead to feelings and feelings lead to actions, right? So maladaptive thoughts means maladaptive feelings, maladaptive actions. So you change the thoughts, feelings, and actions would change. That's a very Western way of looking at things, that how thoughts and feelings affect it. Mechanical, behavioral in that sense. But from a more Eastern grounded perspective, it's that our experience, like what we do, can actually change how we feel and how we think. It's the other way around. Meaning to say that when you start volunteering, for a cause which is greater than yours, greater than you, and you find it soothing because you're helping others or serving others, that would lead a shift to how you feel and how you think. So actions are equally important, not just thoughts and feelings. And remember that it's important and it's absolutely okay to seek professional help, see a psychiatrist, see a provider, see a therapist, and talk about what you went through. It's absolutely okay. It's a sign of huge strength to show up in therapy. Just like we have physical well-being, it's important to maintain that with exercise and diet and going out. But at the same time, it's important to seek your solutions, and it could be seeing a therapist, because Prophet ﷺ said that seek treatment, that Allah has not created any disease that except he has created its cure as well. So it's absolutely okay. There is no stigma and there is no problem in seeking professional help if we need it. And when we talk about what is the way forward, now that we talked about the effect and the healing and what is next, um, what is next is that when it comes to our Prophet ﷺ, he is our greatest role model. Like, Uswatul Husana, like, there is an excellent example for anybody who believes in Allah, in Prophet ﷺ, in his character. Like, Khulqil Azim, that Allah has exalted his character. And what was the way of our Prophet ﷺ? It was not to influence, right? Because we live in this influencer culture and everybody is influencing one thing or the other. His way was not to influence, it was to inspire. He inspired people. He told them, don't do this, and they will just leave it. Told them, don't drink alcohol, they wouldn't drink it. Told them, Allah has ordained this command, do it, and they would just do it. So the society he made actually evolved, which is why the dilemma was always about, among the Islamic scholars, like which parts of Islamic state would actually be imposed on people and which ones can evolve on their own, because Prophet never had to impose things as such, right? So being good role models is the way forward. So imagine this. There was this person whose family supposedly was religious, but they were abusive, or community was abusive. And they grew up with this idea that, what, Muslims are bad, Islam is evil. And they come to you in a personal capacity, or they see you as a therapist who is a Muslim. And suddenly, when they see your character, that you're a good role model, it creates cognitive dissonance, because their image is that Muslims are like this or Islam is like this. But when they see you when they see this religion living in you through your character, they were like, wait a minute, but aren't Muslims supposed to be like this? But this guy is different. So when they feel that cognitive dissonance, they start rethinking their positions about religion, about faith, and about Muslims. So the most important way forward here is things don't change when you tell people arguments that how you are right or wrong. It changes when they realize that you are a person that they can trust. That's where it all starts. The Prophet ﷺ, people became Muslims, and when Islam spread throughout the Asia, when it came to us, for example, in Kashmir, when it went all the way to the Central Asia, to Indonesia, it was not because they started debating and they started quoting books and who was right and wrong. It was the character of people. It was the character. They were like, Muslims are like this. They were mostly, Islam was spread in whole of the Central Asia and Asia, even Far Asia, by traders, by people who were doing business, and with their character. When people saw this, they were like, we want a part of that. And what is it? Oh, it's Islam. Let's become Muslims. So I think the way forward is to heal the trauma in the community, in the individuals, within the families, by being good role models. And ultimately, to conclude, to sum it all up, Rumi said that the wound is the place where the light enters you. It's like this pain, right? It can also be a gateway to healing, to enlightenment. And don't grieve, he said. Anything you lose comes around in another form. That sometimes loss and trauma and what we go through could also be a chance of growth, what you also call as post-traumatic growth, right? We talked a lot about trauma and healing, and now we have the PTG concept, right? Tedeschi and Calhoun, who worked on this concept of post-traumatic growth, but we do have it in our faith as well from a way longer time, that if there is trauma and suffering, there is healing as well. And then Allah has a great plan for that, right? So this is what I wanted to talk about, trauma and the families and individuals who suffer and what is the way forward. So I hope parts of it were relatable or beneficial to you. I pray that to Allah. And now we have some time, and we can go with the question and answers, inshallah. Okay. Thank you very much to all of you for your patient listening.
Okay, mashallah, such an eye-opening and insightful sharing from Brother Yaqeen. So, as we can see, we will open the floor for the question and answer session, which will last for 20 minutes. Dr. Seema, could you kindly assist me by reading the questions from the chat box? Thank you.
Okay, thank you, Priya. Assalamu alaikum. That was a very beautiful and explanatory lecture on trauma. Let me find the questions. Can you hear me?
Yes, you can.
Yes.
There's a question by Sister Sayyida Samia. How do you define safe space trustworthy? Endorser, straightforward, or sincere?
How do we define the safe space? I think ultimately, if it's a subjective feeling, when we start feeling that we are within a space, and trust building takes time. I understand that. It takes a while. But when we feel that we are within a space, and this is a space where I share something, right? And it is safe with these people. And ultimately, when I share my pain with this person, it could be in therapy, it could be in community, it could be an individual friend of yours, right? That's what strengthens the bond. For example, we know people, we know our friends, right? And over the time, we develop closer bond with certain people. Let's say, even if we have a lot of cousins within the family, we're not equally close to everyone. We are sometimes closer to some people more than the others, right? We feel comfort in that space. And ultimately, it's built over the time when we realize that what I feel deep down in reality, or what has hurt me, I can actually share about it, right? For example, in therapy, those of you who are practicing or who are on this path, inshallah, you will realize it. A lot of the times in the intake forms, the clients, they will say things which are not true, or they will tell you in the initial sessions about certain things which are not exactly true. And then later on, they will come clean because sometimes they want to test your patience. And sometimes they were not ready to share some of the details. For example, when it comes to sexual abuse or being undergoing trauma, they'll be like, no, it's fine. And then they open up, no, something like this happened. And how does that work? It's a process because they realize that if they open up, it's okay. The other person that they are speaking with, it's okay to share with them. So it doesn't happen all at once that you go to someone and it just works like that. So the safe spaces, how do you know that? You have this feeling that over the time that it evolves, right? That's how in the client therapist relationship as well. It evolves over the time when the person realizes it's okay. So with time in therapy, how it progresses is that your clients or your patients, they start telling you bigger things about their life or bigger things what have happened in the past. So in communities as well, I do feel like in many of the Muslim spaces as well, there is this fear of judgment, how I might be labeled, how I might be stigmatized, or what's going to happen if I open up. So I think it's important for the spaces to be forthcoming. And before you feel like, oh, how would I feel if I talk about my mental health diagnosis in this space? The forthcoming part would be if the people or the leaders of that community or that space are trained in Muslim mental health or mental health in general, or mental health first aid, they would know that it's okay. And they might be forthcoming. Those of you who might have undergone trauma or mental health conditions, it's absolutely okay to talk about your pain. That's all right. So another part is having support groups or safe spaces. Like, we run certain support groups like online or offline where people come and share about, people know each other over the time. They do some activities together and they know that whatever they say here is an amana. It's said in a very confidential sense. So I think it's a process. And over the time, if you don't find any safe spaces, we try to create one. And I think right now we need a lot of them for healing what is happening in the community ultimately and in the world at large, inshallah. So I hope that answers your question.
Thank you, Ustad. It was a very comprehensive answer. I think it has been answered. Now, there is another question by Sayyida Samia. Speaking under resentment towards Deen, how much knowledge of Deen is expected from the therapist to set the ground straight?
Right. That's actually a very good question. Like, when it comes to the therapist, how much of religious knowledge should they have, especially when they are addressing the resentment that is coming out of the religion? But here, the first idea is that therapy is it's not a ground for debate. That your client comes up with this argument, you're like, no, it's not like this, it's like that. That's not how it works. It's not a confrontational part. People are looking for safe space in therapy, right? So the idea is if they have resentment, we try to see where that is coming from, right? And then we try to externalize the problem, right? So in the end, when they say this happened to me and I went through this, and this person was religious or he was a community leader, and then you will try to separate that. Was that because of religion itself, or was it because this person tends to be like that? Okay. So when we distinguish, and like I said, cognitive dissonance, when they see a good role model in you, part of them would already be knowing that not all the Muslims and community leaders are the same, because as a therapist, you're also a community leader, and they'll be like, this person is different. So they're already contemplating in this phase that not everybody is the same. So once they're able to distinguish that, and mind has the capability to do that. So when it comes to TIP or the Islamic psychology modality, traditional Islamically integrated psychotherapy that I practice, for example, it is important to have very clear fundamentals in fiqh and usul al-fiqh and Islamic history, and knowing these things, at least they are considered helpful. And you need to have a little bit of religious readings part done in order to be a TIP therapist as well. But not necessarily you have to be an Islamic scholar, and you don't have to get into debates that, oh, this is what you think about religion, but that's not right. So what it does is when we invalidate the other person, they suddenly shut off. Then the therapy part is not going to be helpful. Yes, they can go, for example, to an imam, or for example, somebody who deals with polemics of religion and ask them these questions. But that is not the part of the therapy space. You don't get into debates. All you try to do is use your religious knowledge to create either that cognitive dissonance we talked about, to validate their experiences, and then we try to distinguish once that therapeutic alliance is established. But it's not confrontational in nature. It's more from an emotional, focused, and experiential perspective. I hope that answers your question. Okay.
Okay, and there's one more question by Sister Fatima Ahmed, our co-founder. And the question is, any tips on how to hold a safe space with a large group and little time? For instance, after watching a heavy film about Palestine, how might be some ways for people to process in a large group with people they do not know?
Right.
If one has gone through childhood trauma and later on, after having their own children in utero, this is probably another question.
Another question. Mhm. So let me ask the first part. Very valid question, and I also feel this. For example, you're seeing something very heavy, and tomorrow also we have this program, another safe space, which is a closed group. That's why it's not up, because 7th of October, it's been 1 year of suffering in the Palestine. So we are doing something about that. So I'll be speaking there. So it's a large safe space, right? So what do we do? So if the space is large and you saw something which is painful, like what's happening, for example, the new Al Jazeera documentary about Palestine, it's like heart-wrenching when you see it. Then you do what we call as debriefing. Debriefing is like, if the group is huge, which means in this safe space, not many people, not everybody can come up with the microphone and they will start speaking. So what you do is you have these pointers when it comes to debriefing, right? So for example, we watched this, right? And we feel a certain way. So the facilitator or the speaker in this safe space would sort of take the lead and lead the other people, because it's a huge group of people. So you're leading them in the direction that this is what we watched, and what we are feeling right now would be a normal response. It could be sadness, it could be feeling of disgust, or it could be a lot of these feelings. And these are the steps we can process it, right? From remembering Allah to doing some grounding exercises to doing zikr. Or it can be collectively done in the group, because the time is also less, so that everybody, when they leave, they know exactly what they watched and they have been debriefed for what happens later on. Because the debriefing part is very important here. So if the time is less and the space is like a lot of people, important to have those pointers, like, what are we going to watch? What are we going to see, for example? And some of the takeaways from that, and putting them in the perspective. So I have tried that, and it has helped and worked for me. And I hope it does the same for you, inshallah.
Thank you. It was very good answer. There's one more question by Afsha Ali from Bangalore. If one has gone through childhood trauma and later on, after having their own children, and you try to repeat the same behavior with them, not wanting to do the same, but still the behavior comes just naturally, how does a person stop the cycle and does peace with it?
Right. And I think that's a very important question to be asked. Like, how do we stop this cycle, right? Because somebody has to come up and stop the cycle, right? And sometimes this intergenerational trauma, how does it go from generation to generation? Sometimes it's the stories, sometimes it's the fear. And you see this lot in children, that those who come to therapy with you, for instance, and you will see that they are living certain fears even as adults. But when you go deep down, they're actually not their own fears. They're actually the fears of their parents, or they're living the fears of their guardians or caretakers that they were close to when they were growing up. So that's how the trauma cycle goes on. But I think when you are asking this question, it means you have the insight. You have realized the fact that something that I went through my childhood was not right. Okay. And how does it stop? Acknowledging that, maybe seeking therapy and professional help. And also the fact, acknowledging the fact that Allah is there for your children as well. And your children also have autonomy, right? Meaning to say this, if you have undergone, for example, victims of sexual abuse, they become very protective, for example, for their children, like extraordinarily protective. Being protective to some extent is good, but when you overdo it, it creates dependence and takes autonomy and sense of agency away from the child. Like they feel like they're not good enough to do anything, or they feel like my parents or my mom cannot trust me if I'm out with my friends like 10 minutes later than this time. Like, why is this so much control? So this fear of the parent is perceived as control by the child. And that's where it becomes maladaptive. Communication is good, but at the same time, remember that the Allah that watches over you watches over your children as well. It's okay. They also have sense of decision making. If you have, your job as a parent is to teach them good moral values, to teach them about religion, but later on, trust to Allah. Like, tie your camel, then trust Allah. And this is also an important process. Like we often quote this hadith, right? Tie your camel, then trust Allah. Imagine how liberating this idea is, that as a parent, you did your best, but let it be. The children, Allah is there to guide them as well. It's okay. Plus, this idea, this illusion of control, that if you don't do this, this, and this for your child, they're going to be led astray. That's not always the way it is. So it's sometimes trusting the process, trusting how you taught your children, and ultimately trusting Allah. Because ultimately, if the child wants to do something, they will still find a way to do it. So the idea is not ending up controlling their lives, because it's coming from a good place. And I have seen this in parents. It always comes from a good place. But it's also sometimes we are projecting our own fears upon our children. So it should not also end up happening like that. So a balance is very important. And being a parent is difficult. It's understandable. But ultimately, you do have to trust the process and trust Allah and know that it's all right if children make their own mistakes. You know what ends up happening? We call it confirmation bias in social psychology. For example, child wants to do something, right? You tell them as a parent, don't do this, because if you do this, you will end up hurting yourself. And they go and do it, and they actually end up hurting themselves, and they come back to you, and you're like, see, didn't I tell you that? That you shouldn't be doing this, and you hurt yourself. See, I was right. This is confirmation bias, that even if you were right, but that was the child's mistake to do. We learn as human beings experientially. We will not learn if I tell you that, an apple is really very sweet, which comes from Kashmir. We have good apples there. I can give you a guess, like it's tasty, it tastes like honey, it's very sweet, but you wouldn't know what it is like until you eat it. Then you will be like, yes, there I go. The apple was really good, which Yaqeen got me from Kashmir. Similarly, if you tell your child it's dangerous or don't do it, right? Certain things, I'm not saying this is a general rule, but the idea is, even if you were right, but they did a mistake, rather than saying, "Ha, I told you this, why would you do this?" It's important to tell them, how did that make you feel? You now did it, right? Rather than like this idea that I have to be correct all the time. How did that make you feel? Because it's their mistake to do, and it's their learning process, right? So I hope that answers your question without making it further, inshallah.
Alhamdulillah. Thank you, Brother Yaqeen. It was very interesting and informative. I think there are no more questions. Let me check once. Yes, there's no more.
Alhamdulillah.
There is one. In cases of collective trauma, such as war or natural disasters affecting the Muslim world, how
Right.
can Islamic psychological interventions help community rebuild and recover? We are the spiritual and psychological tools that community leaders can
Right.
something employ to
Can
and
employ to aid collective and healing. I
Ah,
think a very important, profound question, right? When we are dealing with, like, in last year, we were dealing with the earthquake that happened in the southeast Turkey. So I was volunteering there with my wife through our university clinic. And I think most of the people who were there, almost all of them, they were Muslims. So I think when there is a calamity and when there is this collective trauma or a natural disaster coming out of it, even from an Islamic perspective, the first thing that you establish is creating safety. Like, do these people have a shelter? Are these people getting enough of the food and the water? So the basic needs, we always start from there. And then you will see this mechanism, and that was very surprising for me as well, that people automatically generate faith when such calamities happen, that they start showing this trait of resilience. And I was thinking that people would be very upset. And when we met these people, and we're talking about hundreds and thousands of people in southeast of Turkey, and they were like, no, this was from Allah, and we are living this. So my take about it is that people have this mechanism of resilience. And then the first month, let's say there is a collective trauma or there is this natural disaster, you establish safety. This is the acute period of it. And then when people are getting back, you help them getting back to a routine. Ultimately, you also give them these tools, right? The reminders from faith that how the whole life is a test of Allah. And this has to be balanced, because here's the part. We only think the test of Allah comes when we are tried with tribulations and difficult times and disasters and traumas. No. When you are happy, this is also a test from Allah. When you are rich, it is also a test from Allah. It's not only poverty. So having that idea of balance, that all life is a test, and that's what we are going through. And one important thing that really helps within the trauma framework of working is asking 3 questions to people who have suffered this collective trauma from the past or the conflict, war, natural disasters. First question, what is lost? And they will be like, everything, right? I have nothing left, right? This is the reaction. So it's an important question to ask, like, what is lost? You sit with them, you talk about it, right? And then the second question, which makes people reflect, is, tell me what is left. They'll be like, nothing is left. But you have yourself left, right? You might have some knowledge, you might have some resources, you might have some connections with the community. So make them count those blessings, right? Because it's very important to have gratitude and collect the blessings, like count them, like what Allah subhanahu wa ta'ala has given us. And then the third most profound question that we work on in the smaller groups is, what are you going to do with what is left? Very important part. So I think that is the model that I use when I work with people who are traumatized, is asking these 3 questions, which make you reflect. And then whatever resources are there, what are we going to do with them? Because that's also an amana from Allah subhanahu wa ta'ala ultimately. So I think this has worked wherever I have applied it, because I have worked with populations in distress in different parts of the world. And it has been a successful model forward. And those people who are Muslims, you can reframe it from a more of an Islamic perspective of shukr, and how Allah gives us things and resources and amana, and we have to use it in His way. So I hope, inshallah, that answers your question.
There are questions coming out. There are many questions, but do you have time, Ustad Yaqeen?
Do I have time? That's a good question. Yes, I still have some time. We can go on.
So there's one question: what is the way forward for us as therapists when client talks about some maladaptive behavior that are considered sin in our religion?
Right.
I think it was answered in
Right.
lecture. Yeah.
Correct. And I think before questioning, like, what is, and this is something that over the years we have had extensive debates with our teachers, mashayikh, and the idea that when you are a therapist, you are not a judge over the people, and you are not accountable about their behaviors. And I know this can create some cognitive dissonance up in the therapists as well. The idea that if a person, for example, if a person comes to you, the person is a Muslim, right? The person is drinking alcohol, and the person has problems with workplace issues, mobbing by the boss and stuff, and they are in therapy because of mobbing part, right? You only deal with the mobbing part, because the person is paying you for this problem, ultimately. You don't go to the alcohol part because you think it's haram in Islam, unless that alcohol has a direct relationship about what is going on. So ultimately, therapy is about the person. It's not about you and your values. Okay? Because if you try to impose those values, the other person will shut off. It's not going to be beneficial for the long term. So if people go to maladaptive behaviors because as it's a maladaptive coping mechanism, for example, drugs or drinking because of the trauma, right? The idea here is in therapy also is creating the sense of responsibility and first acknowledging that something wrong has happened. So we talked about effects of trauma, for example, right? Know for a fact that even though the person has undergone trauma, they might have a mental health condition. It does not absolve you of your responsibility. It's not like you'll be like, because I'm in therapy, I have a mental health condition, I can do whatever I like. You're still what we call as mukallaf. Like, Allah will still call you for account, unless somebody is what you call as majzoub in Arabic, like, the pen has been lifted, that person has no thinking and rational capabilities. But it's not an excuse, right? So similarly, when you talk about maladaptive mechanisms, you will have to draw the link and tell the person like, this is your maladaptive mechanism that you're doing and the effects of it. You have to create insight. Insight means the person knows what is happening to them. And that's one of the parts that a therapist has to do, creating insight in the client. So if they are drinking and we can draw this canvas to them, what effect it's having on their life and how it is maladaptive. So once the person is able to draw that link, because this trauma happened to me, I started drinking. And because I started drinking, my relationships with my family started going bad. My productivity started to decline. I'm also losing money, right? And this is not serving me because when I'm drunk and I do things, it brings a person out of me that's not really me. So these sort of things, like how does it affect your life? Then you talk, which is why in therapy, we don't use generally right or wrong. And to give an Islamic reference out of it, Imam Malik, like, the greatest or one of the greatest of the Imams and scholars, they never used to say, this is halal, this is haram, don't do this haram, or because they believed halal and haram is judged only by Allah. They will say, you Jews or lie, you Jews. This is permissible. This is not impermissible. Similarly, in therapy, we're not like, oh, this is wrong. This is right. We are like, it's adaptive. Like it is serving you and your goals in therapy. Maladaptive. It's not working for you. So create that insight rather than shutting them down. And even though you find something is sinful, that is because you're at a certain level in your faith. Maybe the person has just been a practicing Muslim and they have just started with the prayer and the things which they are doing, like drinking and stuff, they have not reached that level. So if you tell them, oh, that's wrong, how can you do this? They are going to leave even other parts of the faith, right? So that's why there is what you call in Arabic as tadrij. There is this progressive gradualization that has to be implemented in therapy, in life, as well as in our faith. So following that might be helpful, inshallah. And I hope that answers your question.
Yes, there's one more. Should I put
Yes.
it?
I
Sure.
don't think we have time.
Yeah.
Yeah, we're almost near the end already. It's already
Sure.
9:29. Yeah. So
So
okay,
maybe last question or done?
I think we're done here.
Okay, fine. Absolutely. No
Yeah.
problem.
All right. Okay, so sorry, and thank you, Brother Yaqeen, for your insightful presentation. Your guidance on blending Islamic principles with psychological practices is truly enriching. A big thank you also to everyone who participated in the question and answer session. We hope the answers provided have been helpful in addressing your concerns. So to recap, our speaker emphasized the family's role as our first role model, shaping who we are. He explained how, from an Islamic perspective, understanding truth involves both external and also internal reflection as the key to recognizing and addressing trauma and depression within families and also communities. The healing process, as discussed, involves turning to Allah through dua, zikr, sabr, and tawakkul, along with seeking support from loved ones and professionals. From my own view, this aligns with Islamic teachings that guide us to balance faith and with practical solutions. So, As we come to the end of today's webinar, I would like to extend our sincere gratitude once again to Brother Yaqeen for generously sharing his valuable knowledge and experience with us. I also want to thank the entire task force and to each of you, dear brothers and sisters, for your time today. We hope you find the discussion informative and that the strategies shared will be beneficial in your journey toward managing depression. Before we conclude today's session, let us take a moment to recite a closing dua together. This is a beautiful way to seek forgiveness, express our gratitude, and end our gathering on a note of peace and blessing. Subhana rabbika rabbil izzati amma yasifun, wassalamu alal mursalin, walhamdulillahi rabbil alamin. Subhanaka Allahumma wa bihamdik, ashhadu an la ilaha illa anta, astaghfiruka wa atubu ilaik. Now let us take a moment to reflect on the importance of time and righteous deeds by reciting Surah Al-As.
بسم الله الرحمن الرحيم والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر.
Last but not least, kindly take a moment to fill out the feedback forms as your input is invaluable to us. Thank you for attending. Please forgive any shortcomings. Until next time, Assalamualaikum warahmatullahi wabarakatuh. Take care and thank you once again for joining us. Thank you once again, Brother Yaqeen.
Thank you so much, Jazakumullah khair, and thanks to everybody for joining in. I hope to see you in future events as well, inshallah. Take care. Assalamu alaikum.
Waalaikumsalam.